Since 1960, the Blue Cross and Blue Shield Federal Employee Program, or simply FEP, has been committed to providing federal employees and retirees with the quality health insurance they need. We also want to make sure you have a happy and healthy retirement by helping you prepare for what's next. After years of working hard, retirement is a good time to focus on doing the things you enjoy, like developing a new hobby, traveling, spending more time with family and friends, continuing your education, and focusing on your health and well-being. Knowing how you want to spend your retirement can help you better plan for the future. Here are a few tips to help you plan for retirement. 1. Start thinking about your retirement at least 5 years in advance. 2. Don't plan by yourself. If you're married or in a relationship, discuss your plans with your significant other. 3. Know your individual options. Everyone's retirement needs and plans are different. 4. Take inventory of your financial assets. 5. Evaluate your health needs. When it comes to evaluating your health needs, consider what matters most. How important is a large network of providers, overseas coverage, and prescription drug coverage? The other thing to consider is cost. How much are you willing to pay for your healthcare coverage? We can help you figure it out. One of the best things about being a federal employee is that you can take many of your healthcare benefits into retirement. Ultimately, when it comes to your health and your health insurance, the decisions are up to you, but we're here to help. If you keep your FEHB coverage when you retire, you get the same benefits you get now as an active employee. And as long as you never cancel your insurance, you'll have the same coverage throughout your retirement. All federal employees are entitled to retire on an immediate annuity under a retirement system for civilian employees. You're eligible to keep your medical coverage if you've had 5 years of continuous enrollment in the FEHB before your annuity starts and have not converted to an individual policy. This is known as the 5-year rule. The federal government will continue to pay a portion of your FEHB monthly premium. They'll pay about 70% of the cost, and you'll pay the rest. If you do choose to cancel your insurance, you'll never be able to re-enroll in the FEHB program. Let's talk about Medicare. Medicare is a health insurance program provided by the U.S. government. It's available to individuals 65 and older, people with certain disabilities, and people with end-stage renal disease. When you retire, Medicare is usually your primary health coverage. You've probably heard Medicare has different parts, but what are they? Medicare Part A is hospital insurance. It covers inpatient, skilled nursing facility, home health, and hospice care. Part A is free for most people. Medicare Part B is medical insurance. It covers doctor's visits, outpatient services, x-rays and lab tests, durable medical equipment, preventive services, physical and occupational therapy, and other services not covered by Part A. There's a standard premium for Part B based on your income. Medicare Part C is a Medicare Advantage plan. This is private health insurance that provides Part A and Part B coverage. It may also cover things that Part A and B don't cover. Premiums vary by health insurer. Medicare Part D is prescription drug coverage. Like Part C, premiums vary by drug plan. Enrolling in Medicare is a choice. You're not required to sign up, but doing so might be beneficial to your future health needs. You can't enroll in Medicare until you're eligible. For most people, the initial eligibility period begins 3 months before your 65th birthday and ends 3 months after your 65th birthday. If you don't sign up for Medicare Part B when you're first eligible, you can sign up later, but you may pay a late enrollment penalty. This is a 10% premium increase for each year you delay enrollment. The penalty doesn't apply if you or your spouse are still actively working during the initial eligibility period and you choose to keep your employer-sponsored health coverage. Something you might want to consider for retirement is choosing to combine your FEHB coverage with Medicare Part A and B. Both provide great benefits separately, but combining them can give you even more. While Medicare Part A and B cover a lot, they don't cover everything. These gaps include prescriptions, hearing aids, dental care, and overseas care. Your FEHB plan may cover many of these services. Many FEHB plans waive or reduce deductibles and copays when Medicare is your primary coverage. Some FEHB plans also have special benefits or programs that can help members pay for a portion of their Part B premiums. If you decide to keep your FEHB coverage, you don't need to sign up for Part C. But what about Part D? With your Blue Cross and Blue Shield service benefit plan coverage, you can get a Medicare Part D plan if you're also enrolled in Medicare Part A and/or Part B, called the FEP Medicare Prescription Drug Program. Through this program, you receive lower out-of-pocket costs for higher-cost drugs and more approved prescription drugs. all as part of your FEP premium. To learn more, visit fepblue.org/MedicareRx. Something else to think about is that Medicare Part A and B do not cover dental and vision care. That's why enrolling in a FedVIP dental or vision plan could be a smart decision for you. As we mentioned before, your healthcare benefits don't change after you retire. If you're a member of the Blue Cross and Blue Shield Service Benefit Plan, you get access to the great benefits you rely on now, including worldwide coverage, a large network of preferred providers, wellness rewards, and discounts. And you can still choose from one of our 3 plan options: FEP Blue Focus, Basic Option, and Standard Option. But if you decide to combine your coverage with Medicare Part A and B, you get even more great benefits. We'll waive your copays, coinsurance, and deductibles for covered services. If you're a Basic Option member, you get access to our mail service pharmacy program and get a reimbursement on your Part B premiums. Basic and Standard Option members get reduced copays for certain prescription drugs. If you do decide to combine coverage, you'll pay your service benefit plan premium plus your Medicare Part B premium. While this may seem like a lot, if you calculate the cost of both premiums, the overall cost can be lower than your medical costs, especially any unexpected ones that may come up as your health needs change throughout retirement. To see all the ways the service benefit plan and Medicare work together, visit fepblue.org/Medicare. We know there's a lot to think about before you retire. If you have more questions, you can reach out to these organizations to learn more. And as always, you can count on FEP to be with you every step of the way.